Okay. Yes. So these tips, I have repeated these tips in my previous videos as well. For example, whenever you are writing a prescription, whatever drug you are writing, you should be writing in block capital letters, and you should always use black ballpoint pen. Sometimes you might be having green pen, red pen, blue pen there. So you only have to pick up black one, because you are not supposed to write prescription with other ink colors. Okay. And then essential details like patient name, NHS number should be written on each and every sheet. You will be having proper columns for these patient names and NHS numbers, and you have to write them. And whenever you are writing prescription for somebody, or even if you are writing clinical notes, there should be 3 forms of identification. 3 forms of identification can be patient name, NHS number, date of birth, or patient name, hospital number, date of birth. You should be having 3 of these things, so that you are making sure you are writing this prescription for the correct patient. And then drug sensitivity, always check drug sensitivity, even in the exam, and when you will be practicing in NHS or elsewhere in the world. Always, whenever you are prescribing something, before that, don't forget to ask if you are sensitive, or if patient is having any allergies. Sometimes they are only allergic to some things like peanuts or dyes, these kind of stuff. But sometimes there are some serious allergies, and I have seen some patients who are allergic to most of the antibiotic, penicillin allergic. Okay, they are allergic to erythromycin, clarithromycin, and then you are left with only limited choice. But whatever is the case, you should be checking the allergies and sensitivities of the patient, and then you should write your prescription according to that. And whenever you are writing prescription, you should be using generic names instead of brand names. Brand name can be anything, but generic name, like for example, if you are writing clarithromycin, instead of writing Clarisid or any other brand name, you should be writing clarithromycin, right? Exception is insulin prescription, because in only when you are prescribing insulins, you should be writing brand name. For example, there is Quick Pen, Plexipen, these kind of brand names, and you should be writing exact brand name. Apart from that, whatever you are writing, you should be writing generic names. You should be writing dose clearly. Some letters are very confusing. For example, 2 and 1, if you are writing it and if it is not clear, then you can easily, mix up the letters and you can end up giving up wrong dose. Yesterday I was on call and I saw a wrong prescription in which omeprazole was written as 30 milligram, and it was very confusing because nurses were unable to read it as 2 or 3. It was very confusing. So whenever you are writing the prescription, make sure numbers are proper. And then only acceptable abbreviation are grams and milligram. If you are writing microgram, or you should not be writing it as UG. You should always write in full spellings of this. And if you are writing some sachet, for example, we are giving Lexido as sachet, so we can write it as 1, or a figure in Roman letter, you can write it as 1. And whenever you are writing inhaled drugs like steroids, you are writing blue inhaler or brown inhaler. So you should be writing 2 puffs, as strength can vary, right? You should be writing 2 puffs and dose as well, both of these things, because strength can vary. Different inhalers can be having different amount of steroids. We are not doing steroid station today. We are going to do a station about ruptured membranes, and then we are going to write a little bit about anticoagulants today. And then in next session, we will be covering antibiotics. And then I will arrange a session separately for COPD and asthma prescriptions after that. These are the common abbreviations you are mostly using: OD, BD, TDS, QDS. May means morning, and then PRN means as required. So sometimes in your task, you are given these abbreviation. You should know these abbreviation, because according to these abbreviation, you should be writing your prescription in your actual notes. All right. And then there are different sections of prescription writing. If you have prescription writing hard copy with you, you can open it, or soft copy, and see on the first page, mostly it is once only medication. After that, it is antibiotic only. And then it can be having anticoagulant portion. It can be having regular medication and as required medication portion. Anticoagulation portion can be there and it can't be there. Depends on what kind of prescription for papers you are having in the exam. The paper you are having here, not necessarily you will be having same one in the exam. But if you know the sections, you can write your prescription in a proper way. If you are writing anticoagulants, check for your prescription folder. It will only take few seconds, and see if there is anticoagulation portion in that paper and in that sheet of in that bundle of prescription or not. If there is no anticoagulation portion, then you can write anticoagulation in regular part of the prescription. But if there is anticoagulation portion, you will be writing Apixaban, Rivaroxaban, enoxaparin, or whatever is there in your task. You should be writing in the proper anticoagulation portion. And then as required medication, when you are writing paracetamol, PRN, it's written in the task, then you will not write it in regular part, you will write it in PRN part, as required portion. I will tell you about that. And antibiotics are most common things, and almost in all the prescriptions, there is one antibiotic. So you should be well aware of this part of the prescription. Now we have a task here, and I would like you to fill out these details in the first portion in the hard copy if you are having, and let me know if there is any problem. I will give you 1 minute for that, and then we will continue. Please write it down, and if there is any problem, if there is any doubt, let me know about it. And also I will, because this is an interactive session, I think interactive session is most, if we are talking to each other, then it will be, most helpful as compared to only I am talking. So I will need a volunteer in my next task, when we will be doing the actual task, so that we can keep talking. And if there is any doubt, you can ask me. And in the same way, I will need another volunteer for my next prescription. So who will be the volunteer for my first prescription? Any one of you? And it's not about judging, or I'm not testing you for anything. It's just like it will make your life easier. Anyone? Anyone who is exam in next week? Dr. Paul, I think, was having exam tomorrow. Are you here in the session?
Hello, doctor.
Yes. So you want to go for it, for the next task, the actual task, and see what are the problems in that?
Yeah, it's fine.
Okay, good. And do you have hard copy?
Yeah, well, yes, I do.
Okay, perfect. Then you can fill it side by side and let me know if there is any problem. All right?
All right.
Okay. Are you done with this information? We can go to the next page. And actually, you are supposed to write here. So here you will be writing hospital number, patient name, address if there is address in the task. If there is no address, then leave it blank. As I mentioned, three different things to identify the patient should be fine. So write date of birth, NHS number, and then you should not be knowing about ward, hospital. If it is mentioned, then you can mention it. No, you can't know consultant name, so leave it blank. Date written, you can write the date. Today is the date, so write 7 June 1922. And allergies and sensitivity, as it was written as penicillin allergic, so you can write it down here. If you know the reaction, you can write it down. For example, if rash is the reaction, so write it down here, your name, and then signature, and then date. Write date here. So this portion is basically for you and for everybody. It's for medical legal part. So you are checking allergies and sensitivity. So you are writing your name here, your signature here. It means that you have clarified it with patient. If there is no allergies, then you can write it nil, or most of the time we are writing NKDA. NKDA means no known drug allergy. So if there is nothing, you can write NKDA here. Now, let's start doing this task. So Dr. Paul, can you read it loud for me?
Okay. Mrs. Emma Mill, 37 years old, has presented at 34 week of gestation with premature rupture of membranes.
Mhm.
Your registrar is with the patient and had asked you to write a prescription for her.
Okay.
So dexamethasone 10 mg 12 hourly IM, erythromycin 250 mg QDS PO for 10 days.
All right.
The regular medications are calcium, metformin 500 mg BD, and the patient has allergic reaction rash to penicillin.
All right. Thank you. Thank you. So you are having BNF with you, right?
Yeah, I have it.
All right.
And the
So
PDF part.
yeah. So in BNF, what we are going to check, whenever you are writing down some drug, it is very important to check the interactions as well, because sometimes, well, in your lab, most of the times they have written something which is interacting with some other things in the same prescription, and you should know about that so that you are writing the proper prescription. You are being a safe doctor in this way. So yes, so this is BNF, and there is a proper way to read BNF. I know in PDF form it looks a little bit difficult, but in actual book it's straightforward. It's not that difficult. So this is the first page of BNF. And in the first page, you can see Appendix 1 interactions here, right? This is for the interaction part. For example, if you want to know interaction for dexamethasone or erythromycin, you can open interaction part and start looking for either of these drugs, and then you can see if they are interacting or not. Secondly, second important thing about BNF is that in normal books, what we are going to do is we are looking at the contents, and then we will start reading the book according to that. But in BNF, we have to do it in a different way. I want to look for a drug, for say, for example, erythromycin. It's very difficult for me to find it here because there are a lot of different kinds of medication. Although you can, if you want to go to one of these, but it's better if you are opening this index from here. Index is on 1712 page. You can open it index from here and then start looking for erythromycin. It will be alphabetical. It will be easier if you are looking in the index, and then from there look for the page and then open erythromycin and start reading about the drugs if you want to read. If you are looking for example, if you want to prescribe UTI treatment. So in UTI treatment, you can open, for example, you can open genitourinary system from here, 818 page, and look for UTI. And UTI, you will be having some guidelines. What are the first line drugs? If patient is allergic to first line, then what will you do next? If patient is allergic to this, then what will you do next? So all the guidelines will be there. So there are two ways of reading. If you know the drug you are looking for, you can just open the index and then start looking for the drugs. If drug is not given, if they have asked you to prescribe something for, say, hospital acquired pneumonia, and they haven't written anything about it, you can go in infection and then look for hospital acquired infection and then start looking for the right kind of drug. Keep in mind allergies, sensitivities, and what medication patient is already on, and according to that you have to tailor your prescription. Is that clear?
Okay.
And this is the index part. This is how it looks like. So for example, if you are looking for adrenaline, for example, so you will open 277 page and everything is written over there. There will be anaphylaxis dose table there, and then you can start looking. For example, if anaphylactic patient is there and you want to prescribe adrenaline, you can open.
Doctor, I have a doubt.
Yes.
In case we are not sure about the interactions, can we write the drug and then cancel it out?
It's better to check interaction first. Because you are there to prescribe, right? There is no patient, there is no examiner, there is nobody in there. So you have time. You should check the interactions first and then write it down. Although you can cancel it, if something is wrong, you can just cancel it and write a separate new prescription. But it's better to check interaction first before prescribing. And while you are checking interactions, if you can open erythromycin for me and check if there is any interaction for erythromycin to dexamethasone. Can you check?
Okay.
There is, right?
Dexamethasone is once only. Erythromycin.
Yeah, erythromycin has interaction with dexamethasone, right? So in this case, you can't prescribe both of them. You should be having something else, right? And what you can prescribe instead of erythromycin, for that you need to know the guidelines for premature rupture of membranes. So when you are managing someone who is coming in preterm with ruptured membranes, then antibiotic prophylaxis is the thing that you will start. And first antibiotic of choice is erythromycin. If patient can't have erythromycin due to any reason, maybe allergic, maybe due to cross reactivity to some other thing, you can go for oral penicillin. So can you give oral penicillin here? Can you give?
No.
Yeah, no, because patient is allergic. Good. So what will you do? You can go to next drug, which is clindamycin. So these are the nice guidelines, right? So you will go for clindamycin, and whatever antibiotic, patient is not allergic or you are not giving dexamethasone, it's okay. You can go ahead with erythromycin. But because you are going to give steroids and it's not your decision, it's written in the task, it means that somebody has decided to give steroids, and dexamethasone and I think hydrocortisone as well, they are having interaction with erythromycin. You can't give them. If you want to give steroid, you have to think about some other antibiotic. Patient is allergic to penicillin, so you can go for clindamycin. And to be on safe side, you can check clindamycin's interactions as well, whether they are having any interaction with steroid or not. I know it's taking a lot of time here, but for the exam purpose, if you are doing these prescription for a couple of time, it will be easier for your exam day. You will not be thinking a lot in the exam. You know the treatment, you know what to do, and then you can write. Open BNF, check BNF for erythromycin, clindamycin, and write down your prescription. It's not a long prescription. It's just like they are making sure you are being a safe doctor. Have you checked?
Doctor, will these guidelines be given for us in the exam?
In the exam, they have written erythromycin, and I don't think in BNF anywhere you can find about these guidelines about premature rupture of membrane. So I think it's better, if not erythromycin, then penicillin, but you can't give penicillin. So it's better to memorize clindamycin, but you can always check dose for clindamycin from the BNF, right? And then steroid is already given, dose is given, you have to write it as it is. So in these membrane rupture scenario, what we are usually doing is, steroid is not a continuous drug. Steroid is usually given 2 doses, and then consultant can decide about the further treatment of the steroid. So here it's written in the task, dexamethasone 12 milligram 12 hourly IM. So what we are going to do is we are going to prescribe 2 doses 12 hours apart. And after that, consultant can decide if they have to give steroids again or not. And regarding this antibiotic, you can prescribe it for 10 days. Other regular medications are these calcium and metformin. So you can prescribe these. And now this is the prescription you have to write. I have told you what you are going to write instead of erythromycin. You will be writing clindamycin for that. You are going to write dexamethasone and then regular meds. So let's start writing prescription. Dexamethasone, as I already mentioned, you can write it. This portion is once only portion. So in rest of the drugs, if you have written something, for example, here, you are going to continue it for 5 days or 10 days, whatever the scenario is. But here, if you want to give only sometimes you are giving antibiotic at start as a start dose, and then you are going to change the dose. So you don't have to write it in this portion. In that case, you can write it down in here as once only portion, and then the maintenance dose, you can write it down here. So this dexamethasone is also the same case. You will write dexamethasone in once only part of the prescription. Dose is given. You just have to write down the timing. 12 hourly, you can write it down as 8 in the morning and then 8 in the evening. So it will be 20. Or if you want to write at 10, it's also fine. Time is whatever time you want. But it should be dosed at proper 12 hourly interval. Is that clear?
Yes.
Doctor,
And
can
then-
you please repeat that again?
So I'm saying that you know the dose, it's there in the task. You know route, it's there in the task. You know this dose. Drug, you know, dose, you know, route, you know. You are going to sign it here. And then bleep number is, bleep is a device we are using in the hospital. And every team is carrying a bleep. So we are writing our bleep, but for you, it doesn't matter. So just sign it here. And then this timing I'm talking about. So if you are, you know that you have to give this dexamethasone 12 hours apart. So it's up to you if you want to write initial time at 8, 9, 10, 11. It's up to you. But the next time will be dependent on the first time you have written. You have to, pace it at 12 hours. If it is 8 in the morning, it should be 20 in the evening. 20 means 8 p.m. If it is 9, it will be 9 p.m. in the evening. And then if it is 10, it will be 10 p.m., right?
Yeah.
Okay, now next thing. Next thing is the antibiotic, as we already mentioned, clindamycin. So dose of clindamycin is 600 milligram BD. You can check in BNF. So BNF is not mentioning anything regarding premature rupture of membrane, but normal dose for different kind of antibiotic will be 300 milligram QDS, or you can make it as 600 milligram BD. And
So, doctor, we write this on our own without checking the BNF?
You should be checking BNF. I have checked BNF before writing. You should be checking BNF, right?
Okay.
But for the exam purpose, you can memorize it. But to be on safe side, you can check BNF as well. And this
Dr. Kurat,
dose
For 10 days?
do we
Hello?
need to, like, if we, hello, Dr. Kurat, sorry to interrupt you like that, but if we know that, like, if we have to prescribe clindamycin, do we need to show them that we are going to look into the BNF, or
Yes.
just?
Yes, you have to.
Okay, so we have to pretend that we don't know and we are checking the BNF.
Yeah, I would actually say check BNF. But it depends on you. You don't have a lot of time. You have to write it down. So at least you should open BNF in that station.
And this is given for 10 days?
Yeah, this is given for 10 days. So here
You should
there
write
is
it 2
only
times, right?
1, 2, 3, 4, 5. If it is written here as 5 day, right? Because you are not having any more columns here. So If you want to prescribe for 10 days, then you will be picking this antibiotic folder and write it down in the antibiotic section. You can't write it down here. Okay.
So we
If
can't
you-
write it down there.
You
The
can't
next-
write it down here. If you want to, I have written start date here. I have written stop date here. So it's fine if I am writing it 11 till 11/6. In the exam, instead of 5 columns, you can be having 7 columns. You can be having 10 columns. It really depends on the folder they are going to give you for prescription.
Okay.
But if you
Dr.
have
Kurat,
written
can you
stop
please
date here, it should be fine. Even if you are not writing in the next sheet. Are you getting my point?
Yes, doctor.
But
So they
if you
won't
have
penalize
time,
us for this.
sorry.
I mean, they won't penalize us for not writing the second time.
If you are writing for the second time, it shouldn't be on this paper. It should be on a separate prescription folder or a chart. You can't write
Okay.
here, although it looks empty. But if I am writing something and my drug chart is finished, I will start a new drug chart. I will not write anything here. So in the exam, they mostly are giving you more columns maybe here. But if you want to write, I would say finish this part first. Write down your dexamethasone, write down your regular meds, write down once only meds. And at the end, if you want to write down on the next chart, then you can do that. But at least before that, you should be writing everything else so that you are not, instead of writing clindamycin and filling out the chart again, because you have to fill out these details as well for the next chart. It will take more time.
All right.
Just do it at the end.
Doctora, please.
Sorry.
I didn't get the last point.
So I'm saying, if you have to write down something, for example, can you please mute yourself?
There is some background noise.
If you're writing something and it's not like you are giving antibiotic for 10 days, but these are 5 days, you can't give more than 5 days, on this folder, right? So ideally what you can do is you can open another chart, prescription chart, fill it out, fill these details first, and then open the antibiotic only section and write down this clindamycin. But in the exam, because you are not only writing clindamycin, you are writing other stuff as well. So I will advise you to complete one chart first, and after that, open that next chart and prescribe remaining days of clindamycin. Okay. And stop date should be the date, actual stop date, not this 11 date, 11/6. Stop date is 16/6. I have written 16/6 here. And start date is 7/6. So actual stop date, not the stop date for this chart. And then those will be written here, your signature, your GMC number, indication, and then you will write the timings here. Sometime timing is already written, so you don't have to write it down. You can just circle it. And when it's not written, you have to write it down. So you have to paste it at regular interval, like we already talked about, 8 in the morning, 8 in the evening. Sometimes there is a separate section here for the frequency as well, how often you are going to give the drug. So in that case, you will be filling out BD part. You will be writing BD here. If not, then you need to circle these things. I will show you another kind of drug chart. In my previous prescription, I had that one. And for example, this drug chart, see, there is a separate column for frequency here. So I have written down BD here. If there is no column, then you will just circle these things. 1 in the morning and 1 in the evening, write down the time and then write down the time here. But if there are both of these things, then it's an added benefit. And see this drug chart, maybe you are having a drug chart like this in the exam. And in this drug chart, there are more than 5 columns. You can easily write it down for 10 days. 10 days will be here. So it will not be a big problem if you are having this kind of drug chart. But the drug chart we are filling, there are only 5 columns. It depends what kind of drug chart you are going to get in the exam. Is that clear now?
Okay.
And if I am writing something beyond 14 day here, I will not write it down here. Just remember this thing. I will start a new drug chart, fill out the details, and then I will start writing that next one. Okay. So is this clear till now?
For
Hello,
the
doctor.
sensitivities and micro approved, no need to fill them, right?
No. You don't have to fill that because pharmacists will be filling that out.
Okay.
And then comes
When-
regular med section. Open regular med section, and then you will be writing metformin. It's straightforward, 500 milligram BD. So write it down like this. Write down the date here, and then calcium. It's OD, 1 tablet OD. So write it down here. If dose is given, you can write it down as proper dose. For example, if it's written 500 milligram or 10 by 500, whatever is in the task, you can write it down like that, because there are different kinds of preparation. And in the drug chart, like I have shown you the drug chart already, if you are writing dates here, you don't have to write dates with each and every drug. If on the top there is a column for date, you don't have to write it down for each and every drug. Just write it on the top, and then for example, if this was not antimicrobial section, this was, for example, these are the regular prescription section. I have written down date here, and with each and every drug, I don't have to write down the dates. I will just write down rest of the details, and then timing I will mention, but I don't have to write down date with each and every part. Is that clear? You can write it down on the top and then just skip it in the middle. That's fine. Is it clear for now?
Yes.
If the column says frequency, like this drug chart, it is saying frequency, then obviously you are going to write BD or D or TDS, whatever. But if there is no column for frequency, then you can't write it down actually. So it's important to circle it. It's even more important to circle it. If there is a column, then write OD, BD, etc. and then circle it as well. Now it's clear? Somebody has asked this question.
Doctor, what are those 2 boxes in the end after the
Which one?
cross? On 17 and 18. Yeah, those 2